Chasing Zero, Winning the War on Healthcare Harm, is a very informative video and a great reminder of our important roles as healthcare providers. Before coming to work every day, and even before we start our daily task, it is always a good habit to always ask ourselves the following questions. What and why am I here for? How can I make an impact to my patients, their families, and my colleagues? Do I want to leave a good impact or a negative one? How can I make my patients, including myself, safe? Then at the end of the day, we always also have to ask ourselves the following questions. Did I make a difference today? Am I satisfied with the care that I gave to my patients today? Was I able to help my colleagues and my team achieve their goal? How can I help in facilitating change towards safe practice? We do this every day to remind us of the importance of our roles in other people's lives. Errors, whether human or systematic, are inevitable, but we have the ability to correct and prevent it from happening in the future. Nurse Julie Tao, pharmacist Eric Kropp, patients and families of Dennis Quaid, Sue Sheridan, Stephen Braxton Rell, Sorrel and Josie King, and all the healthcare facilities that were involved were all unfortunate victims of healthcare harm that we all can learn from. These people and their experiences had a tremendous impact in the healthcare industry and how we do our practice nowadays. While we have come a long way in facilitating safe practice with the aid of technology to keep our patients from harm, we still have a long way to go towards closing in and getting to total zero healthcare harm, such as the case in 2017 in Vanderbilt University Medical Center involving nurse Rodonda Vaught. We all know that she was convicted of criminally negligent homicide and impaired adult abuse after mistakenly administering the wrong medication to an elderly patient, causing her to die. There were a lot of discussions and arguments among people in the healthcare field and those non-healthcare individuals surrounding this particular case. I am very sure it put a strain on Nurse Rodonda Vaught and her family's lives, as well as the patients' families' lives as well. The errors, these type of medical errors, are still happening nowadays, unfortunately, despite technological advancements that are already in place. This just goes to show that errors in healthcare happens, but can be prevented if every stakeholders, including all of us, will do our fair share of being diligent to proactively participate in measures to mitigate errors and be always reminded of our basic roles, especially in providing safe and quality care. It is also very important for us nurses to be able to openly admit our mistakes and share our experiences with our supervisors and co-nurses without a fear of retaliation and being criminalized for our errors. Sharing errors, whether personal experience or not, helps others, especially the new ones, to learn from it and hopefully practice safe nursing in the future. Just like an old adage that says, to err is human, to forgive is divine. Mistakes should never be kept secret, and those who committed errors should not harshly be prosecuted. Human as we are bound to commit mistakes, and to prevent it from happening again is by learning from it and sharing it to other individuals so they too can learn from it and prevent it from happening in the future. What better way to learn from our errors than from our own and other people's experiences? We must always empathize and try to put ourselves in our patient's shoes and think about what kind of care we wanted to get in case ourselves or our family will need it in the future. Thank you very much for listening, and once again, I appreciate all that we do.